Hey, Dr. Tyler Williams at Pinecrest Dental. Thanks for being here for today's video. And you're here because you have some questions about all-on-4 dental implants, or you're considering all-on-4 dental implants, or you're not sure if you should save your teeth, remove your teeth, replace your teeth. And those are all great questions that we'll get to in a minute. But first, just want to give you kind of some idea of what an all-on-4 is if you're not familiar with it, and the reason why you can have 4 implants but a full mouth of teeth. So if you think about it kind of like a vehicle, right? You can have a motorcycle with 2 wheels that can carry 1 or 2 people. You can have a car with 4 wheels that can maybe carry anyone from 2 to 5 people, or a similar vehicle, right? Most cars have 4 wheels. So 4-wheel car might carry 2, 4, 5, 7, 8, some even 16 people, and even more when you get into like a bus or something bigger. So the amount of wheels you could correlate to the number of implants you have, and the people in the vehicle could be the number of teeth. So you might be able to have 4 implants, but you can have maybe 10 or 12 or 14 upper teeth or lower teeth on those 4 implants. And it's important to know that if you have an all-on-4, but you lose one of those implants, something happens to it, and there's only 3, generally that entire arch will fail and it won't work. So oftentimes we'll put a 5th implant or a 6th implant in at no extra cost, just to make sure that you have enough implants there in the case something happens down the road. You don't have to have all of this work redone. You don't have to have the procedure or the surgery done again, which can work out really well. So that's a common thing that people ask us and come see us for. Now, as far as what you're a candidate for, you can call our office or email us. We can send you a book on this exact topic that we wrote, that I personally authored, and it talks about the 3 R's. And we do have some extra copies of those, or if you stop by the office, we can be happy to share one of those with you, or possibly even ship one to you. But the 3 R's mean refresh, renew, or replace. So with refresh would be you would take some of your existing teeth that are stained or yellow or dingy and you'd brighten them up, right? That may not be an option for you. Maybe your teeth are so bad, but a lot of times we can take a tooth that looks not so hot and brighten it up, right? Think about it like painting your house, right? You're not necessarily replacing walls, but if you put new paint on there, they can look like new. With the second R, which is renewing your teeth, that would be like replacing a wall in your house and maybe putting some new casing on it, or new window frame or new trim, and painting it, right? So you're rebuilding something that was damaged or wasn't the shape you liked it to. And that's where we use things like veneers and overlays and ceramic and bonding. We can make your teeth look as good or better than implants in many cases. And then the third R is replace. So if you have teeth that are too damaged to save or teeth that are missing, we would look at replacing your teeth. And this gives you the option to have a nice smile. Most commonly, if you're watching this, you're probably a candidate for a combination of 2 or 3 of these things. For example, a lot of people have maybe 8 or 10 or 14 teeth that are actually pretty decent, and you may be a candidate for some combination of Invisalign to straighten them, then veneers to make them look beautiful and as Hollywood or as natural as you like, depending where you're at on that scale. And then you use implants to replace the missing ones, and that can work out really well. Now, if you're not a candidate for saving any of your teeth, you can look at an all-on-4 that screws in, or something like an all-on-4 that we call a snap-in bridge, and that's a removable implant bridge that allows you to clean it a bit easier. And there are pros and cons to that as well. But just know that you have options. If you go somewhere and you only get one option and there's no opportunity to get a second opinion on this, then you should be careful, because I've seen people take that one option and then regret it later, and you don't want to go down that road if at all possible. We're here to help answer your questions. So thanks for taking a minute to watch this video, and we'll catch you on the next one. Have a great day.